Thank you for choosing Summit Doppler Systems, the company you can depend on for high-quality diagnostic products. This video will provide detailed instructions for using the Vantage ABI to diagnose peripheral arterial disease, also known as PAD. The ankle brachial index, or ABI exam, will be demonstrated. PAD is a common manifestation of atherosclerosis. Per the American Diabetes Association, it affects 8 to 12 million people in the U.S. every year. Most common among diabetics and the elderly, PAD is underdiagnosed and undertreated, resulting in many patients at high risk for heart attack, stroke, leg amputation, and even death. The ABI is a simple, inexpensive, non-invasive test for diagnosing PAD. Early detection and treatment of PAD can prevent severe cardiovascular events. Striving to provide new technologies to better serve the needs of healthcare providers and patients, Summit Doppler developed the Vantage ABI. This innovative cuff-based system uses digital Fourier oscillometric, or DFO, waveform analysis, which Summit Doppler co-invented with researchers from the Cleveland Clinic, where the first validation study was also performed. This new technology is a significant improvement in ankle and pressure determination and PAD assessment over traditional forms of oscillometric ankle pressure estimation. The Vantage ABI has everything needed to conduct fast and accurate ABI exams. It has a graphic display with a convenient, user-friendly touchscreen for navigating the system. The accompanying USB memory stick is placed in the flash drive for exporting exam data to a personal computer for easy interface with EMR systems. A built-in printer is available on some models for printing exam results on adhesive-backed label paper for easy placement on ABI assessment forms. The system is available with or without a roll stand and storage basket. The Vantage ABI is so easy to use that after the cuffs are wrapped and the patient rests, with the touch of a button, the entire ABI exam takes just 3 minutes to complete. Now, I know you're anxious to learn how to use this new system, so let's get started. When you power on the system, the ABI main screen will appear. If you need assistance at any time during the exam, touch Help on the main screen to open Help options. Touch any of the options listed for the detailed instructions to appear. Touch Back to return to the ABI main screen. Touching Menu on the screen opens Menu options. By selecting System Settings, the System Settings menu appears for customizing the system. Touching Back on the screen returns to the ABI main screen. Under System Settings, touch Set Clock to change the clock and calendar by using the numeric keypad which appears on the screen. Touch Clear or Back to make a correction. Done when finished, or Cancel to exit without changes. To adjust the display contrast, touch Set Contrast in the System Settings menu. Continue to tap Set Contrast with your finger until the contrast is optimum. When the Auto Power Down option is set to On, the system is enabled to turn itself off after 20 minutes of inactivity in order to conserve battery power when not in use. To disable the Auto Power Down, touch Auto Power Down in the System Settings menu and set the option to Off. When Auto Inflation is touched, the option changes from a number 1 to a number 2. When number 1 is selected, one limb pressure will be acquired at a time. When number 2 is selected, both the arm and ankle cuffs on one side of the patient will be inflated simultaneously. The system default is set to 2. Touch the Waveforms option for automatic PVR waveform acquisition. The system default is set so the Vantage ABI can automatically obtain the ankle waveforms. Begin the exam by having the patient remove their shoes and socks. Allow the patient to rest in a supine position for about 5 minutes prior to taking pressure measurements. You may use this time to discuss the patient's current symptoms and to wrap the blood pressure cuffs. It is important to select the proper size pressure cuff. The proper cuff width is 40% of the patient's limb circumference. For limbs with a circumference less than 28 centimeters or 11 inches, use the 10 centimeter cuff. For larger limbs, use the 12 centimeter cuff. For most patients, a 10 centimeter cuff is used at the ankles and a 12 centimeter cuff at the arms. Place the cuff as shown here for brachial pressure. Avoid rolling sleeves or pant cuffs in a manner that could obstruct blood flow. For the ankle pressure, wrap the cuff just above the malleolus. Avoid placing the ankle cuff too high, which could result in inaccurate ankle pressure readings. After properly wrapping the cuffs, connect each of the hoses to the appropriate limb cuffs as labeled near the ends of each hose. Touch Start on the system's ABI main screen to begin the exam. The cuffs will inflate and the Vantage ABI records the data as the cuffs deflate. After a few moments, the Vantage ABI will display the ABI results. At this point, the exam can either be printed or saved for printing or exporting at a later time. If the battery is too low for printing from the built-in printer, a pop-up warning will appear suggesting the system's power supply be plugged in to complete printing. If the built-in printer is out of paper or jammed, a pop-up warning will appear. If this occurs, follow the instructions provided in the user manual for adding and/or replacing the paper. To manually obtain waveforms using the Vantage ABI, touch Menu on the main screen and then touch System Settings from the menu options. Touch the Waveforms option for automatic PVR waveform acquisition. The system default is set so the Vantage ABI can automatically obtain the ankle waveforms. Manually obtaining the systolic pressures for the arterial sites is very easy with the Vantage ABI. We will demonstrate at the right arm or brachial site. After properly wrapping the cuffs around the patient's arms and ankles, touch the arm site on the screen. A list of options will appear along the right side of the screen. Touch Pump and Vantage ABI will inflate the right arm cuff until the blood flow is occluded. As the cuff deflates, the system will record the systolic pressure value. The pressure value will appear on the ABI main screen at the arm site. To change or re-enter a pressure value, touch the ABI site to be changed, and then touch the Enter option on the screen. Touch Clear to make a correction, Done when finished, or Cancel to exit without changes. To skip or disable a particular site, such as in the case of an amputee, touch the site to be skipped, and then touch Off. An X will appear at that site indicating it is to be skipped. To reset that site, touch Enable, and the X will disappear, so a pressure value can be obtained. If the system requires that a pressure limit be increased, an L with an up arrow will appear at the site. A pop-up warning will also appear. In this instance, touch the site on the main screen, touch the Limit option on the screen to change the pressure limit. There are two options for increasing the pressure limit. 180 is the default, and 280 is the optional limit. Touch a selection, and then touch back to return to the previous screen. To return to the ABI main screen, touch Done. Similarly, if the pressure limit is to be decreased, an L with a down arrow will appear at the site and the pop-up warning will also appear. Touch the site on the main screen, touch the Limit option on the screen to change the pressure limits. For decreasing, there are also two options. 60 is the default, and 35 is the optional limit. Touch a selection, and then touch back to return to the previous screen. To return to the ABI main screen, touch Done. Obtaining PVR waveforms manually using the Vantage ABI is just as easy as obtaining pressures. We will demonstrate by obtaining the right ankle waveform. Begin by touching the site on the ABI main screen, and a list of options will appear along the right side of the screen. Touch Pump, and Vantage ABI will inflate the right ankle cuff to 65 millimeters of mercury. The system will display the PVR waveform on the screen. Touch Scale to change the size of the waveform on the screen. Be sure to make the waveform as large as possible without clipping at the top. After viewing for 4 to 5 seconds, touch Save to record the PVR ankle waveform. A check mark will appear in the ABI main screen at the site to indicate that the waveform was obtained. To skip or disable an ankle waveform, touch the waveform's site to be skipped, touch Off, and then touch Done to return to the main screen. An X will appear at that site on the main screen, indicating that PVR is off. To reset that site, touch the site on the main screen, touch Enable, and then touch Done to return to the main screen. The X will disappear, so an ankle waveform can be obtained. The ABI calculation involved dividing each of the ankle pressures by the higher of the two brachial pressures to obtain the patient's right and left ABI. A difference of more than 20 millimeters of mercury between the right and left brachial pressures may indicate an upper extremity stenosis. If this occurs, verify the brachial pressure and consider further testing if the variance is repeated. The Vantage ABI quickly calculates the patient's ABI results automatically after the pressures are obtained by the cuffs. Recent guidelines published by the American College of Cardiology and the American Heart Association indicate that an ABI value less than 1 is cause for concern, and ABI values less than 0.9 indicate the presence of arterial disease. A normal ABI value would range between 1 and 1.29. Unlike a Doppler-based ABI, the Vantage ABI can properly classify many patients with non-compressible arteries. However, if the ABI is above 1.3, the patient should undergo further testing, possibly including a toe brachial index exam. While you are performing an exam, rather than seeing the pressure values next to the sites on the display, you may notice several alternate symbols. If an X appears, that site has been disabled and no pressure values or waveforms can be obtained. If a check mark appears, an ankle waveform has been obtained. If an L with an up arrow appears, increase the pressure limit for the site to 280. If an L with a down arrow appears, decrease the pressure limit for the site to 35. If the pressure limits must be changed, a pop-up warning will also appear on the screen. If an arrow pointing up appears at a site, the system is currently inflating that cuff site. If an arrow pointing down appears at a site, the system is currently deflating that cuff site. 3 dots at a pressure site indicate that the system is calculating the pressure. If the letters NA appear, an erratic waveform is detected and is not analyzable. A pop-up warning will also appear. In this instance, the patient may have moved during the measurement or may suffer from tremors or arrhythmia. In this case, it may help to repeat the pressure determination at that site, which can be done by selecting the site and touching Pump. Finally, if AR appears, the test results were abnormal and the ABI was not calculated. Presence of PAD could not be excluded. A pop-up warning will also appear. The Vantage ABI can automatically obtain ankle waveforms using the pulse volume recording, or PVR, with the cuffs. The diagnostic value of the ABI is enhanced by the analysis of lower extremity waveforms. Waveform analysis is especially valuable for patients with non-compressible arteries. The normal PVR waveform resembles the arterial pressure pulse. The normal waveform has a sharp systolic upstroke and a relatively narrow, well-defined peak. After peaking, the waveform drops quickly. There is a noticeable dichrotic notch. This is an abnormal waveform. Distal to an arterial occlusion, the waveform becomes more rounded. The rise and fall times are extended and the peak is less pronounced. The Vantage ABI offers the ability to easily manage patient data files or exams. There are 20 exam storage locations for saved exams. If all 20 exam storage locations are full, a pop-up warning will appear. Delete or export exams in order to begin storing more exams. To begin, touch Menu on the ABI main screen, and the menu options will appear. To save a completed exam, you must first assign it a file name. Note that a pop-up warning will appear on the screen if a file name still must be entered. Under Menu Options, touch Save Exam. Use the alphanumeric keypad to enter a file name for the exam. Touch Clear or Back to make a correction. Done when finished, or Cancel to exit without changes. After touching Done, the ABI main screen returns and the exam has been saved. The saved exam will be listed with the file name assigned under Exam Management. Be sure to note that any data not saved will be lost when a new exam is started. A pop-up warning will appear on the screen if any data has not been saved from a previous exam. Touch Yes or No to continue. By selecting Exam Management, the menu appears for saving, viewing, deleting, or exporting exams. On this screen, you will also be able to view any previously saved exams. Use the up or down arrows to scroll through the list. If no exams have been saved, the screen will be empty. To view a previously saved exam, touch the exam to highlight it, and then touch View. The selected exam will appear on the screen. With the Vantage ABI, you are able to export an exam to a USB flash drive for viewing on a personal computer. Begin by touching the exam to highlight it, and then Export to download. Note that a USB memory stick must be plugged into the Vantage ABI prior to exporting. A pop-up warning will appear if a USB memory stick is not detected in the system. Delete an exam by touching the exam to highlight it and touch Delete. The selected exam will be deleted from the list. Note that a pop-up warning will appear asking if you are sure you want to permanently delete the exam. You must select Yes if you wish to delete. Once you have made your selection, the Exam Management screen will return. To delete or export all of the exams in the list, touch All, and all exams will be highlighted. Touch either Delete to delete all or Export to export all. When finished, touch Back in the Exam Management menu to return to the ABI main screen. Once the files are exported to a USB memory stick, you can remove the stick and connect it to your computer to view the patient exams using the Vantage Report software. To begin a new exam, select New Exam from the menu options and use the alphanumeric keypad to assign it a file name. Touch Clear or Back to make a correction, or Done when finished. After touching Done, the ABI main screen appears to begin the exam. Note that the exam cannot be saved until it is complete. A pop-up warning may appear if you attempt to save a new exam prior to completion. When the exam is complete, be sure to save it under Exam Management under Menu Options. The last option in Menu Options is Restore Backup. Touch this option to return to an exam that you were performing prior to the system powering down. A pop-up warning will appear when you power on the system if an exam was not properly saved the last time the system was in use. The Vantage Report software allows you to import exam results from the Vantage ABI and annotate patient data, add clinician interpretation and comments, and print a patient exam report. To begin, insert the Vantage Report installation disk into the CD-ROM drive of the computer. Installation will start automatically. Note that the minimum requirements for using the software include an operating system only with a 64 or 32-bit Windows Vista Home Premium or better. Select Next on the Welcome screen to continue the installation. Select Install to load the Vantage Report software to the computer. It will take a few seconds for the installation process. When the software installation is complete, a notification message appears. Select Finish to exit the installation process. When finished, an application icon appears on your computer desktop. Double-click on the icon to open the software. The report data will be segmented into sections and separated by tabs at the top of the application. Select the appropriate tab to access or enter information. The Patient Info tab contains user-editable information regarding the patient, general comments, and the examiner identification. The Pressure Waveforms tab contains non-editable pressure waveforms and ABI information from the imported file. The ankle and brachial pressures are included, along with the modality used to obtain the pressures. Waveforms are displayed as well as the time and date stamp. Under the File menu, there are several options for managing a report. Notice the Export option. Select this option to generate either an Adobe PDF file or a comma-delimited file. Here is an example of an ABI report saved as a PDF file. Under the Preference menu, ABI severity ranges may be edited. Also, the facility information in the report can be personalized to include the facility name, address, and a list of physicians. This will be stored in the application and used on each subsequent report that is generated until changed. Thank you again for choosing Summit Doppler Systems for your diagnostic needs and purchasing the Vantage ABI for the diagnosis of PAD. At Summit Doppler, customer satisfaction is our highest priority. We stand behind the Vantage ABI with a full warranty and guaranteed service. If you have any questions after watching this video, please contact us at 1-800-554-5090 or visit our website at summitdoppler.com today.